What's up, guys? So we finally decided to do some YouTube videos to help you guys pass this beast of exam. Actually, it's not a beast; it's just this simple exam of Nclex. What is Nclex? What's the big hype about it? So basically, we want you to make. What I mean, it's like the people, the government wants you to make sure that you are competent. I mean, you're safe to practice um, nursing, and then you have to write your exam, and we want to make sure you're safe. You're not gonna basically kill somebody. You're not gonna cause any harm to anybody actually, and you know what you're gonna do. What's your next step in providing help? To the patients. So remember, you are in a position of power as a nurse. So you should be able to help these people. These people are vulnerable. That's your duty to help people, and you have to be humble. You're able to help somebody, save somebody's lives. So this is what all the hype is all about. These Nclex things. We want to make sure that you're safe to practice. So in order for you to be safe, you need to know your stuff. So if you don't know your stuff, you can't pass the exams. So that's what the problem we're having. We're finding like a lot of students are failing the exams, and so that's why we're here. So a little background about myself. I started teaching online for the past couple of years after lots of students that I had during the clinicals, the last rotations with me in Northern Canada. We asked me to teach students. So because everything that we do in our clinic, it was reflected on their exam. So, and the students that were on doing the clinicals with me were able to pass at 75 and one student at 76. So which was actually amazing. So a little background about myself. Don't want to bore you guys. I graduated from Trent University in 2009, 2010. Actually, I obtained my degree in 2010, but I finished the program in 2009, December 2009. I started working at PRHC. You guys, some of you folks would know where PRHC is in Peterborough, Ontario. Then I moved on to Kamloops, BC, where I trained in Emerge. I worked there for a few years. Amazing experience, amazing Emerge. But unfortunately, it was time to move on, so I moved on to the north. I worked with the First Nation people. Amazing experience, amazing people. Very fortunate to be able to work with the First Nation people. So that's where I am. So yeah, that's a little bit of background of myself, what I've been doing the past few years. So IntegratedNclex, what is that all about? Actually, it's a very simple system. Like, it's a very simple concept actually, that you integrate a lot of things together. For example, somebody coming with a peripheral neuropathy to your clinic, and you'd be like, hey, I'm having some numbness, tingling sensation to my legs. I don't know what's going on. So what's going to be your diagnosis, your differential diagnosis? So you should know from the history, you should be taking a proper history from the patients. So even from a peripheral neuropathy, what can be causing a peripheral neuropathy? It could be your diabetes, it could be your vitamin B12 deficiency, vitamin B6 deficiency. So vitamin B6 deficiency, now I'm going to tell you like what drugs will actually cause you vitamin B6 deficiency there. So you have drugs like isoniazid, INH, which can be used to treat what? TB. So people taking TB medications like isoniazid can have a deficiency in B6, and B6 can cause peripheral neuropathy. So all of those things can be into differential diagnosis. There's other causes like vitamin E deficiency also can be doing the same thing. So lots of those vitamins deficiency can do that. There is also cerebellar issues. You can end up having those neuropathy, ataxia, So these are some of the causes. So this is what we do in integrated NCLEX. We just kind of incorporate everything, like the clinical aspect of things, your concept that you basic concept that you should know. We just kind of mix up together, and then so you make a clear picture for you guys to understand what's going on. I find that many of the students that I had in the past lacks content. Everybody say, "Oh, can you tell me? Just show me only these things. Like select all that apply questions." I'm very weak at this. I'm very weak at those things. Teach me those things. That's what I need to know only. But guess what? In order for you to know all of your select all that apply, you should know your basic content. If you don't know your basic content, how are you gonna know how the hell to answer all those questions? So if you don't able to answer select all that apply, that means your content you're very weak in your content. Same thing as your priority questions. Hey, what is the priority for this? What is the priority for that? So it all depends on the questions, which type of question we're asking and how we're asking the question. The priority will change. But some of the questions, the priorities are always the same: A, B, C, and your A, B, C, and your vital signs afterwards. So these are the things you should know. This is the thing we teach in our classes. We teach based on like previous questions, previous experience that we had, and that's what we actually do. We actually teach you how to answer those questions, how to tackle those questions, and work from there. Okay, so for example, let's see. In our class a few weeks ago, we did ophthalmology. A lot of students like, eyes. It's simple. It's so easy. There's not a lot of questions on it, but it's so easy. Let's move on. We can finish this topic like in an hour or so. That's too easy. But guess what? When I asked a few questions about the basic anatomy of things, a lot of students was not able to answer those questions. So in order to understand the pathophysiology, the pathology of diseases, and how to answer your questions on your exam, you should know your basics. You should know your anatomy. You should know where your aqueous humor is being produced. Where is your vitreous humor being kept? You should know all of those things. If you don't know this, then how will you answer your questions? How are you going to answer a question about glaucoma? How about if they ask you something about the treatment of glaucoma will be surgical treatment, and this person have a trabeculoplasty? You'd be like, what the hell is trabeculoplasty? I never heard about trabeculoplasty, but yet you should know this. So it all came down to your basics. If you don't know your basics, you will not be able to succeed any further. There's a lot of sources out there. It's going to give you a lot of, lots of informations, overloading you with lots of informations. You're going to be very confused about what to study, what not to study. Don't waste your time you guys are not medical students. You are nursing students who are trying to pass your NCLEX. It's a one step ahead to get your license. So don't complicate things for you guys. Make it simple. You should not know all your mechanism of action of all your drugs. They don't ask you all of those things. How does adenosine work? Where does it work? What is the mechanism of action of this? What is the mechanism of action of whatever drugs like mannitol? Actually, mannitol you should know the mechanism of action of mannitol. You should know it's an osmotic diuretics, which actually even is used in glaucoma. So in an emergency setting of glaucoma, you can actually use mannitol. Mannitol is actually a osmotic diuretic and is used in acute glaucoma to decrease your intraocular pressure. So very important to know these things. And then you should know also about the side effects of the mannitol. So we cover all of those things in the classes. Like now, for example, this is your eyeball. Everybody has two of those. It's the same thing for everybody. So first thing you should know is your anterior segment. Just look at the cursor, and then you have a posterior segment. You're like, oh, what's so big deal about it? Anterior segment, posterior, who cares? Actually, you should, because the posterior segment, you have the vitreous humor, whereas the anterior segment, you have your aqueous humor. So what causes glaucoma? What the hell is glaucoma? How does it form? They'd be like, oh, I'm so confused. Is it the vitreous chamber that's caused the pressure? Where is the intraocular pressure? It's actually at the front here in your anterior segment. Your aqueous humor is produced by your ciliary body, right there. And it actually doesn't drain this way. It drains on to the forward and the anterior, basically the segment that's actually in front. That's where it actually drains from to. Okay, so it's actually produced here, like I said, in your ciliary body, and it just go like this. It drain there in this direction. It goes around your iris, and then it goes into your something called your trabecular meshwork. And from the trabecular meshwork, it will actually drain into your Schlemm canal. So, and then from the Schlemm canal, it goes into your venous system. So your body reabsorb it. That's where it's at. Okay, so these are the things you should know. It will make things easier for you. So if there's a problem in dysregulation of the aqueous humor, and that will lead into glaucoma. So basically, that's what glaucoma is, with the dysregulation of the aqueous humor. So basically, it's not draining very well, or this mesh network has trabecular meshwork, and the Schlemm canal could be blocked. So hence, like I was talking to you earlier, trabeculoplasty. So basically, you open up those trabecular meshwork in an open angle glaucoma. So these are the things you guys need to know for your exams. What's the difference between open angle, closed angle glaucoma? Which one is acute? Which one is not acute? When can you use atropine? When should you not use atropine? And then the main drug they should always know about is your anticholinergic drugs. Keep that in mind. Anticholinergic drug, you need to know about that. Okay, so I hope you guys have an idea of what we do in our class. Hopefully this helped. If you have any questions, you can just post it down there in the comments. If you like it, just subscribe to the channel, and if you have any more questions, ideas of the videos, just again write it down. I'll read your comments, and we'll make some more videos. So otherwise, you guys can join our class. You can go to our Facebook page, facebook.com Nclex Nursing Tutor. So you can look us up there. Usually we end up putting the class, what we're teaching and what we're not teaching, when our class are located, when actually all our classes are online, and we provide all these classes online, and we provide the videos of the classes to you after the class and the notes, so you don't have to go and buy any books. You don't have to do anything else. So the notes, the videos, everything is actually included in your fees, and that's it. If you have any questions, I look forward to be reading your questions and your concerns. Anything, anybody can actually send me a message on Facebook. You can message me here on YouTube. Look forward to answer your questions. Okay, until next time, see you guys.